Welcome back to the Full Nelson. I'm Rob Nelson. Okay, we overeat, we drink too much, we get fat. When we get fat, we diet to lose the weight. But sometimes that's not a quick enough fix. So for a lot of us, plastic surgery becomes a great option, especially liposuction, sorry, a procedure where women and a growing number of men can actually buy their beauty. Joining me now is Pam Lipkin. Pam is a very good, very respected plastic surgeon. And actually, Dr. Lipkin is one of a growing number, but small number, of women plastic surgeons who, have gotten a lot of attention for doing special surgery. Pam, tell me about this. And I know you do a lot of surgery for a lot of people. Is it a problem that some people are coming back and just doing it excessively over and over and over again?
Again, we get back to the same philosophy of what is excessive. For instance, if you have your eyes done at age 40 and a little bit of liposuction of your tummy that's never been flat, and you're very, very happy with that, and 5 years later you notice that your neck is a little bit loose and you go in for a facelift, and that leads to maybe a little bit more liposuction of a new area that seemed to pork out over the years.
Yeah.
Is that excessive? We're up to 4 or 5 operations now over a period of time.
Would that be excessive?
I don't think that's
Not
excessive
necessarily.
at all.
Do you see people? Let me switch it from excess for a second. Is this a quick fix?
It's not a quick fix at all. You're not. Nothing else will fix it. It's not
Right.
a quick fix versus the slow fix. It's a fix.
It's a fix.
It's a fix. It's an improvement. It's something that makes you look better. It makes you feel better.
Right.
Whether the world agrees with what you've done or the world likes the way you look before or after more, it doesn't really matter. You're happy with the surgery,
Right.
you're happy with the results, and for you...
Now, what happens, though, when people start, Michael Jackson's sort of the example everyone uses, but when someone starts going, okay, did the nose, did the eyes, does that happen? And then they just,
Yes, it does happen.
Jocelyn Wildenstein is the, I want to look like a cat, this woman who wants to look, if you know what she looks like.
She loves the way she looks.
She does?
She loves the way she looks. I know her. I did not do her surgery.
Okay.
However, she loves...
She may be the only one who loves the way she looks, but that's all that matters.
The way she looks. The surgeon that did her is a very good friend of mine, an excellent surgeon. I'm not sure he would do that on the majority of his patients, but she loves the way she looks. And if he didn't do it, she'd go to somebody else. So for her, the surgery was unbelievably successful. She loves the way she looks, and that's the hallmark of success, is whether the patient is happy.
Well, let me ask you, Dr. Lipkin, can you tell in your own mind when someone says, I'm going to be happy if I do this, but you're going, this is too much, you're going too far?
Yeah, there's a judgment issue there. If Jocelyn had come to me, I don't think I would have done that. I don't think I would have done Michael Jackson's 9th rhinoplasty.
What about the giant, Robin, you have these people, these giant implant women.
Well, they do that for
Tracy Tops, Wendy Whoppers.
Right, Wendy Whoppers, Lisa
Their boobs
Lips.
are as big as my head.
They all do. And I know, and the list can go on, but it's actually bigger than my head. But they do that for a living.
And your head's big.
Because we have been in a society that says the bigger, the more. The more,
Yeah,
the
but it becomes
bigger
almost
the
a shock issue. The size that he's talking about is not even aesthetically...
We're going to take a break. We'll pick it up as soon as we come back. Stay with us. All right, we're back. The Full Nelson. So I just want to get right back into where we left it off, because we were talking about excess plastic surgery and Tracy Tops and Wendy Whoppers and these people with these crazy names. And isn't that excess? Women who have boobs this big?
Yeah, I think it's disgusting, actually. I would never... I don't consider that aesthetically pleasing.
But what if the woman does, though?
Because
you're
okay,
thinking
but I
that's
wouldn't
okay.
necessarily do that.
Excuse me, but Rob, all the men in the audience here, would you go to see a stripper if she had small little breasts?
No, that's not what we're talking about. We're talking about normal, large, nice.
Well, what do you think? You're laughing here?
Looking, as opposed to something out to here that looks like it will explode.
No good.
There you go. More than a mouthful's no good to this guy.
That's my line. That's my line.
I think with plastic surgery, one of the questions is, will you feel better if you do, or do you feel bad about yourself if you don't?
That's true.
And if you feel bad about yourself if you don't, then that's a problem.
What if Bernadette wanted to lose weight? Could she do it through liposuction? Would that...
No, I don't think so. But
no, it's only for small.
Well, that's not true.
Well, I don't.
Does. I said, what if
there
she
are
she
some
likes
doctors actually who believe that you can do what they call large volume liposuction. They could take out 20, 30 pounds, which is a good start of a nice diet. I don't agree with that. I think it's dangerous, but it's, that's not to say that my opinion is everybody's opinion. There is something called large volume liposuction where people
suck out huge amounts.
40 pounds of fat.
And is that dangerous? Unhealthy?
I think it's very dangerous. Absolutely.
But it works, right?
If you survive it, it works.
Well, or if your skin doesn't corrugate.
Right.
That's not usually
but
a
I mean,
problem,
again,
actually.
everybody seems to kind of come down to saying if it's my excess, it's okay.
We're not talking about excess. We're talking about a few little operations to make you feel and look at it. And why are people doing it? Why is it seemingly
Because we have an
excessive?
well, I think the argument would be
because
it's
who they
good.
are. Why can't they be happy
that
with
would be
who
the
they
argument
are?
because people are
It's not a matter of
changing who they are.
You know, people have to evaluate what makes them feel very good. And it's not these people are coming and feeling ugly and disgusting and wrinkled and this and that. They just want to look a little bit better. And if surgery does that safely, with quick healing, the surgery is much better today than it was even 10 years ago. It's safer. Why not?
Right. I actually don't have a problem with it, but yet I understand that a lot.
Then.
What's that?
We live in such a vain society then.
But we do live in a vain society, right? I mean that's, you know, it's what
Nobody's
Bernadette's saying
perfect.
all the time. Like people look at her and say,
And you
"You're
know,
fat,
people are
that's
not
bad."
perfect
Like,
after
you know,
surgery.
there's this standard.
I've been told by one person that I could use my nose done.
One person.
You should
By
do
one
it.
person. Oh, the other
you
person
should
don't
do your
have-
nose.
Oh, you see, there's a
She's saying
there's
it's
a
true,
business
but
relationship.
I like my nose.
Then
it's
you
part of
shouldn't do
my
it.
character.
You shouldn't
it's part
do it.
of who I am.
All right, welcome back to the Full Nelson. All right, doctor, let me ask you. I thought about this at the break. Is it possible that we're a society of instant gratification? I mean, the difference between living with what you have or aging naturally or like working off some fat in a diet and going in for liposuction is it's instant. I mean, I saw a thing where this woman got a chin thing and it was like, it's called the 3-day facelift. She got her little chin thing taken out like over the weekend. The weekend,
right. Well,
right?
you
One
know,
weekend you got it, Monday morning it's gone.
People want instant gratification. They're very impatient, actually. Surgery does take a few weeks to heal sometimes, and they want to know in 3 days why they're not healed yet.
Is that healthy?
Well, it's, you know, people are impatient. They want the surgery, they want to see the improvement, and they want it now. But, you know, in general, 3 weeks is not that long to wait. It's soon enough. So in a way, there is this... Plastic surgery is instantaneous. It does accomplish something that nothing else can do.
Is that kind of our society as a whole? I mean, the desire for more. I mean, look at the millennium. I mean, everyone's like, what can you do for the... You know, it's like, how much more can you top everything?
Don't believe the hype then.
Well,
That's what we
we've
can
all
do
bought
as
into
a
the hype,
society,
haven't
is
we?
not to believe the hype. I mean, we are our own regulators of our own lives. We have that control.
But can we regulate ourselves?
Absolutely.
Really?
And if you can't,
you think so?
then you definitely need...
Here's the answer, for instance. You talk about plastic surgery, cut up her credit cards, lose weight. She'll lose weight by not having those credit cards in her pocket. So you can do it all at one time. The answer is hear me now
And a
or
little
see me
sex
later.
on the side, and you can hook up with the Bucks team, and it can all be good.
I'm reminded of a line from a song about tabloids. The rich aren't really happy, but here's how you can be rich too. And I think that we're a very ambivalent society. We want to consume, and we're morally condemning of it.
That reminds me of a song, you can't always get what you want, but you get what you need. And that basically grounds us back down to going to our basic needs. Eating, sleeping, a moderate amount of sex, a moderate amount of credit, spending.
Are we going to look back, Austin, on the 60s and 70s, you know, how we look at them now? We're going to look back in the 90s and kind of go, that was nothing? It was nothing?
To spend that much, you mean?
Yeah, are we going to look back at this era as a nothing time? Like this was nothing next to what people are going to be doing 20, 30 years from now. They'll come in, have new organs, rebuild them from
Better
scratch.
operations.
Better operations.
That
That
heal
can
more
happen.
quickly.
Doctor, you've had plastic surgery, right? So, I mean,
Absolutely.
it's taken a generation now. The plastic surgeons are having plastic surgery.
On each other.
Yeah. So, I think you're just going to see at a certain point, your children will probably have plastic
You know
surgery.
what the interesting thing is? Plastic surgery has
Children
been around
are, right?
for a long, long, long time. We're just talking about it now, which is what has changed, really. I don't think, and there's more plastic surgery being done, of course, but it's been done for 50, 60, 70
Yeah,
years.
but then there's
in
something
excess.
wrong with that. There's something wrong with that. Why do we all have to have the same nose, the same blonde hair, the same boobs?
Well, first of all, good plastic surgery does not look like
raises
it's
up another show,
like you've had
probably,
plastic
but
surgery.
Maybe
And not
so,
everybody
where we
does
can
the
show more
same nose.
boobs, which will get us more watchers.
If we all look the same with
Plastic surgery does not make you look the same. That's a misconception.
I know a lot
actually.
of people who have gone, a lot of the Tracy Topps and the Lisa Lips have gone to the same doctors and they all look the same.
All right, you guys.
That's
time
bad
out.
surgery.
I'm sorry. We're done. We're out of time. I want to thank you guys for being here.